Good evening, all the aspirants. The class will be taken by Dr. Naveen, sir, and the topic is Epidemiology, Class 3. So, you can start.
Good evening, everyone. So we will be starting the last part of the epidemiology, which is a very short class, but you can expect some 2 to 3 questions from this topic. So most of you will be knowing about the diagnostic test and how to analyze the diagnostic test. So I will not waste time. I will start it. See, if you have any doubts, just let me know then and there. It's a bit confusing at some point of time. Okay. So when you get a diagnostic test, this is a table 2 cross 2 table which everyone knows. This is constructed to know the sensitivity, specificity, the positive predictive value, and the negative predictive value of a diagnostic test. So how it is constructed is, sorry. Okay. So you make a 2 cross 2 table. Let us assume this is the disease positive, the disease negative. This is the test positive, negative. So once you run the test, some particular percentage of the patients will have a positive test. So that is A, which is true positives. So one who is having a true positive, we will be labeling it as A. See, the labeling can change, but make sure once you are remembering the formula as A by A plus C, make sure which is A, which is B, which is C, because most of the people get confused with this B and C part. So just be clear that how you are labeling that is what matters. So it is true positive. So true positive means that how much percentage of the patients with the disease are detected truly. Okay. So this is a true positive. So once we'll just see how the table is constructed, then we will move on to the individual variables. So view once the test and the disease is positive, it is A. When the disease is negative, the test is positive, that is B, that is false positives. When the test is negative but the disease is present, it is C, that is false negative, that the test is not able to diagnose it. So that is C, which is false negative. What is D? It is true negative. The disease is also absent and the test correctly identifies that it turns negative. So that is D. So what is the sum of A plus C is actually disease. So B plus D is the percentage who doesn't have the disease. Okay. So make sure that you remember this correctly, the A, B, C, D notation you're giving, only then your formula will be right. So we'll be further moving on to the test variables. So what is sensitivity? So sensitivity is the ability of the test to correctly identify individuals who have the disease, meaning that true positives. So let us assume that the total number of patients who have the disease is 100. The test identifies 95% of the patients with the disease. So the sensitivity comes out 95 by 100, which is 95% sensitive. So meaning that 95% of the time, the test will truly identify the patients who has the disease. Okay. So it is given by the formula by A plus C. That is true positives divided by true positive plus false negative, which is equal to the percentage of actually who has the disease, matlab disease positive. If you sum up of this, it is actually the patients who have the disease. The true positive is A by A plus C. Okay. So when do you use a highly sensitive test is that when you don't want to miss out the disease. For example, let us assume that a patient is having myocardial infarction. So now you will choose TROPE as a test because it has very high sensitivity that it will correctly pick up the patients who has the myocardial infarction. So we will be using the highly sensitive test when we don't want to miss up people with the disease. For example, TROPE and MI. Okay. So this is just an example. We'll be moving on. This example is the COVID test is 90% sensitive. It means that it identifies 90 out of 100 infective patients, meaning that the 10 percentage is false negative. That is that it will detect it will flag it as positive, but the patients will not be having COVID. So that's what sensitivity means. So now we will be moving to the next variable. Uh, the true negatives. What is true negative is the ability, specificity is the ability of a test to correctly identify individuals who do not have the disease. So when do you use a highly specific test? So for example, you are planning out an intervention on a patient. You should be doubly sure that the patient doesn't have a disease, then you will not do the intervention on them. That is when you use a highly specific test. So the test is given by the formula the true negative. True negative is D by true negatives plus false positive, which is means the total sum who don't have the disease negative. So that is given by the formula d by d plus d. A highly specific means few false positive. So if you have a highly specific test and it turns out to be negative, then means that we are very sure that the likely that the patient is not having the disease and we will not do that intervention on them. Okay. So if the cancer test has 95% specificity, it currently identifies 95 out of 100 healthy individuals, meaning that the people who don't have disease. See, basically, you will be tested with the formula whether you know how to calculate sensitivity, specificity. Okay, so just understand just remember the formulas as well along with that. So, what is positive predictive value? See, people often get confused between positive predictive value versus sensitivity. This is where people get confused. You can see the formula also. It is A by A plus B. Sensitivity formula is A by A plus C. So you just be very careful with the formula. So what is positive predictive value? Like you do the test on a particular patient, and the test turns out to be positive. Now, what is the probability that the person actually has the disease if the test turns out to be positive? So this is very bit confusing. So I will give you a scenario. So there are 100, you go to a tribal population. So they don't have any two-wheelers. So they usually walk for a long distance. The chance that these tribal people having diabetes mellitus type 2 is very, very, very rare. You do a test on all the tribal population, and the test gives 80% of positive test for diabetes. You know that the patients are unlikely to be diabetic positive. That is called as pretest probability, because that they are usually walking and they're very thin, and there is less chance that they have type 2 diabetes. But the test is giving 80% positive rate. That means there is something faulty in the test. Now we cannot be very sure that if the test is positive, it is whether the disease is there or not. So this is what the positive predictive and the negative predictive value comes in. So once you, what is the probability that the person actually has the disease? If the test is positive, then you will think whether the patient actually has the disease or not. Though there is an 80% positivity rate, but the population incidence, the prevalence of diabetes, it's less than one that particular percentage, then how can 80% of the test be positive? So now it becomes very less likely. So this is a positive predictive value. Now, what is the difference between sensitivity and specificity is that the positive predictive value depends upon the disease prevalence. If a particular disease is less in a community, it means that the positive predictive value will be low. Okay, so we will go on to the, if the test is having a high positive predictive value, it means that it is trustworthy when it becomes positive. For example, if the test with high positive predictive value is positive, it means that the patient is likely to have the disease. So negative predictive value is similar, that it tells us that if it turns negative, what is the probability that actually he doesn't have a disease? Okay, is a probability that a person doesn't have the disease given the test is negative. So the formula is d by c plus d. The specificity formula is d by b plus d. So yes, people often get confused between these two: negative predictive value versus specificity and positive versus sensitivity. Just remember the formulas, which is the denominator. So when do you use a negative predictive value? The test with the high negative predictive means that it is trustworthy when it gives a negative result. The classical example is D-dimer test. So when the patient is having a problem, had a surgery. Now 5 days after surgery, the patient is having a unilateral pedal edema. Now what you do is that you calculate all the scores and then you decide. Then you do a D-dimer test. When the D-dimer has a high negative predictive value, meaning that if the test is negative, it is unlikely that the patient is going to have the DVT. So that is where the role of the negative predictive value comes. So again, it is influenced by the disease prevalence. So it is higher in rare disease where the most people are disease free. So for example, if the disease itself is rare and the test is negative, then means you are very confident that the patient is less likely to have the disease. Okay. So just summarizing what is the four variables. The primary difference is that the positive predictive value and the negative predictive value are extrinsic, meaning that it is affected by the prevalence. It is affected by the prevalence. So if the prevalence is high, the positive predictive value will go. If the prevalence is less, then the negative predictive value will go high. If the confidence is increasing. Sensitivity, on the other hand, sensitivity and specificity are not affected by the prevalence. They are the intrinsic property of a diagnostic testing. So this can be tested in your MRCP. Sensitivity and specificity are intrinsic properties, where the positive and negative predictive values are extrinsic, meaning that they are liable to change with population to population, unlike the sensitivity and specificity, which remains the same in any population set for that particular test, right? So these are some definitions that I don't want to confuse you. Once you do the formulas, you'll be knowing it better, okay?